Is it okay to do an activity or exercise if it hurts? Well, the simple answer is yes. If we're always going to try and avoid pain and never do things in case it hurts, then that's probably likely going to delay our recovery, and it can stop us doing things we enjoy, and it can actually inhibit a full recovery as well. The caveat to that though is that we shouldn't just push past pain and force ourselves to do things even if we're having high pain levels. So how do we know what's safe to do? How do we know what we can do, what we can't do? To help answer that question, because it's a question I get asked a lot in clinic, and to help navigate that, I use a traffic light analogy or a traffic light system. And with the traffic light system, what you do is you rate your pain on a scale of 0 to 10 whilst doing any activity or exercise. And you also monitor your pain scale for the 24-hour period after you've done that activity, because sometimes our body talks to us the day after, and it might be that it feels okay at the time, but it's the next day that it increases your pain levels. So we rate our pain on a scale of 0 to 10 whilst we're doing it, and for the 24-hour period after. If your pain is a 0 to 3, then that's a green light. That activity is going to be safe. If you're getting a 0 to 3 out of 10 pain, it's probably going to be quite helpful to you. Your body can recover from that really well. It's likely to be making you stronger and more resilient. So keep going. A 0 out of 3 pain is a green light. 4 to 5, it's got a little bit careful. You're unlikely to be causing any damage or causing any problems with that, but you don't want to push it much more, and it might be worth just easing off a little bit. But again, don't worry too much if you cause a 4 or 5 from activity. You're probably better off occasionally going into the amber zone than trying not to have any pain at all. And if pain gets to a 6 or more out of 10, then it's likely at this moment in time that activity or that exercise is just a little bit too much for you, and we want to gradually build up to that. And yeah, a 6 or more, then just stop that and utilise other strategies to get your body to be able to cope with that at a future date. If your pain is always 6 or 7 or more out of 10, then this traffic light analogy might not be the right graded exposure or the best pacing strategy to use, and you might be better off utilising other strategies to decrease your pain levels first and maybe look at some other pacing strategies. However, the traffic light analogy is a really good way to gauge the level of or really good way to gauge the level of activity you can do without causing damage or irritation. So if you want to go back running or walking or going to the gym and it causes pain and you're unsure if that's going to cause more damage, then use this traffic light analogy to help inform your decision and alter your activity levels accordingly.